Hello and welcome to webinar series. Myself Shanti, and today's very interesting topic is all about on the mechanism score about audit score in post-op care, as this is one of the very great standards tool which guides that the patient has safely recovered from anesthesia and fit for transfer out or discharge. For this discussion, now I welcome our expertise, none other Dr. Lavanya ji, who is our senior consultant anesthetist from Somajigoda Unit, Yashoda Hospitals, and every nurse's favorite. Yes, I welcome you, Dr. Lavanyaji.
Thank you so much. It's an honor to be part of this meeting. I know it's a very interesting topic actually, and we all know that being nurses are very important in our recovery of any patient, isn't it? And they are like guiding angels. They are like guiding angels in recovery of any patient, more so in the recovery post-anesthesia care unit, because the patients are just recovering from anesthesia. So we'll go ahead with the topic. Yeah.
Yes, thank you for your very interesting insight. And now I request all the speakers to introduce. Yes, over to you, Veronica.
Good afternoon, one and all. Myself, Veronica. It is my pleasure to participate in this interesting session. I would like to thank Shanti ma'am for giving me this opportunity. Over to you, ma'am.
Yes, Pretty. We have
Good
Pretty
afternoon,
also.
one and all. I am Pretty Mol Joseph. I am a nurse manager in Post-Operative and Surgical ICU in Somachiguda, Yashoda. I am very thankful to attend this webinar and giving chance to Shanti ma'am. Very grateful to attend this webinar. Thank you.
Thank you. Yes, we do have a nurse from High Tech, one of our unit. Yes, Tanu.
Thank you, ma'am. Good afternoon, ma'am. Good afternoon, all. Myself, Tanushri. I am also post-op nurse. Thank you, ma'am, for this opportunity. I also want to learn.
Yes, we all will learn and ensure that this awareness, is being shared with all of our nurses, not only in Yashoda, across. Yes. So, yeah, we like to understand from Lavanya, madam. Yes, because this scoring system is a common rate. So, ma'am, for your insight, does this score effectively measures recovery from anesthesia? Over to you, ma'am, for your first update.
Yes, this moderate this Aldrete score is very good scoring system. Actually, for the past 40 years, we have been using this in assessing the recovery of the patient from anesthesia. Though some of the things are missing, like pain and nausea, vomiting, but that is okay, means because all these other things will be measured by our sisters in other charts and all.
Yes.
So it's a very good thing. Yes, for the past 40 years, many of the hospitals has been using this.
Yes. Thank you. And let us see what we have in the rest of the session. I think Tanu and Pretty, you both are the bedside nurses, and we should learn from you. Only Dr. Lavanya will guide us whether where we are going wrong or right. Yes, about this beautiful standardized checklist. Yes. So, Pretty, would you like to explain us what is this Aldrete score checklist? Like, yes, over to you.
Actually, Aldrete Score is the very helpful system for in the post-operative nursing care. The scale we are used determining the post-operative patient, surgical patient can be safely discharged or shifted from the ward when post-anesthesia.
Good. So you mean to say soon after the surgery is done and you receive this patient, and from then the checklist measurement starts, right?
Yes, when the post-operative post-anesthesia, we will start it for the patient monitoring in the Aldrete
Yes.
Score.
Yes. So we also like to understand from Lavanya madam, like in very simple term, how because the viewers are also interns and fresh nurses, So over to you for your little crisp, simple definition of the same, ma'am. Yes.
So in this Aldrete score, we will be measuring 5 parameters, isn't it? One is that activity, then respiration, then circulation, consciousness, and oxygen saturation. So you can simply remember as ARCO, ARCCO. Yeah, ARCO is like a mnemonic. So we can simply remember these are the 5 parameters, and each will have 0, 1, and 2 scoring. So 2 being the highest and 0 being the lowest, and the total scoring will be 10. And any patient getting 9 to 10 scoring is very good for discharge in the sense shifting from the post anesthesia care unit to the ward, and less than 8 we have to still monitor the patient until he gets a
Yes.
good score. Yeah.
Yes. So we do have a nurse educator who is from Hyderabad, and her name is Veronica. Yeah, Veronica, do you like to have your, insight for this checklist? Yes, over to you, Veronica.
Uh, Ma'am, can you explain why is the Aldrete score is important after anesthesia, ma'am?
Yeah, because we will be giving the patients sedatives, opioids, volatile anesthetics, and whatever anesthetics. So the patient will be having less means consciousness. The patient will be drowsy. They might have, because of the spinal anesthesia, the movement of the limbs will not be there. So we have to, wait for some time until the anesthetic effect wears off, and then once the patient becomes adequately normal, and then we will be shifting them, so that when we are shifting the patient, we are absolutely sure that the patient will be safely shifted to the ward and there will be no mishap or any complications for the patient. So that is why this moderate Aldrete score is very good. So this is enough for us in the post-anesthesia care unit.
Hope you got this insight, Veronica.
Yes, ma'am. Fine.
Yes. So, Tanu, can you just tell us how do you, what are the parameters involved in this? Like, how do you, as a bedside nurse, what all you check as you receive the patient from the OT? Yes, Tanu.
Yes, ma'am. When we receive that patient in OT to post-op, we'll check first patient respiration, saturation, BP, consciousness, activity. That 5 parameters have to check patient.
Okay, and then what do you do at the end? Like, you score and then
Yes,
you
we will,
inform the doctor
yeah, we
and
will,
then shift.
yes, ma'am.
Yeah, yes, okay. What if, systolic blood pressure is high? Let's say one patient who is a surgical case of cholecystectomy and associated comorbidity with hypertension and all, and the patient BP is more than 140 mmHg. What do you do in such case?
First, we have to check patient history of any hypertension is there or not. If
That you
patient,
have already done. Yes. Next.
then we have to inform our doctor.
Yes. If doctor is not around, what will you do?
We have to cross check, ma'am.
Yeah, you'll have to cross-check manually also. You can call, escalate to your seniors, then inform to the doctor for the, guided, decision making. Yes. So, yes. So all of your post-operative nurses are aware of this audit score?
Yes, ma'am.
Yes. Okay, Veronica, are you seeing this score for the first time, or you were aware of this such kind of mechanism which takes place in anesthesia unit?
Yes, ma'am.
First time?
Yes, ma'am.
Okay, so I would wish to understand from Lavanya madam, because she also does a lot of rounds and patients vigilance is being monitored by her also. Ma'am, do you think this all your nurses are aware of this checklist, and you keep getting a lot of escalations if at all patient is not seemingly doing good? Yes, ma'am, over to you.
Yeah. So in our recovery room, where this is typically a post-anesthesia care unit, almost all the sisters are very good with the Aldrete scoring and all these things. And all this Aldrete score is not only followed in the recovery room. We can use it in the endoscopy room also. So because there also we are giving sedation. The sisters there also little good, but I want all the other sisters also to be little used to it, because they are from the ward, they are getting the patients from the OT and the PACU. So if they have a little bit of knowledge about this Aldrete scoring, so they can get in the handover how the patient has recovered well. So that will give a very good information about the patient, and then from there the continuation will be happening from OT, PACU and to the ward. So that is a good thing if all the sisters have the knowledge about it. Yeah.
Yes. So further going ahead, yes, Veronica, your insight on the same from ma'am. Yes, over to you.
Ma'am, does it apply for these cases like GI cases and spinal epidural? Can you explain it, ma'am, please?
Yeah, sure. Am I audible?
Yes, ma'am, you're
Yeah.
audible. Yes.
Okay. So, because in especially the activity part is in it, activity in that extremities, they are moving all the 4 limbs. If you give spinal anesthesia, the patients will not be moving the lower limbs. So we'll have to wait for 2 hours or 2.5 hours until the patient moves. And also spinal anesthesia or any general anesthesia can cause little different disturbance in the hemodynamic status. Like the patient may develop hypotension when they reach the recovery room. So we will have to give them fluids, or in sometimes vasopressors like the ephedrine, whichever the anesthetist will guide you to give. And then we will have to wait for some time, and then the patient will improve. So definitely any anesthetic, especially the spinal anesthesia and general anesthesia, will cause disturbance in all these things. So we will have to monitor, and also the drowsiness, because we are giving the sedation and the volatile anesthetics. Yeah.
So very interestingly, very valid points you have, provided, ma'am. And going forward, yes, pretty, as now we know the components of this, parameter. Now, how do you score these? Can you just throw your insight on the same, pretty?
When we are assessing the Aldrete score, the respiration, the patient apneic, bradyapnea or tachypnea is both are there. We will be according to the score. Patient is a normal range, we will be give a score. If the patient is drowsy, apneic count will be coming down, we will be keep on the score 1. The apneic patient respiratory rate was very less, we will be make us 0. And saturation, if the patient is in the room air saturation maintained as well the normal, we are giving the 2 mark score for that. If the patient is in the oxygen, saturation will be coming down plus 91% to well down, we will be keep as the 1. If the patient was not maintaining 90% with O2 also, will be make a 0. Then the patient will be stay back on our post-anesthesia care unit. And the circulation, if the patient is baseline BP when we are taking to the post OT, according to that BP plus or minus 20, if higher or lower, both will be both plus or minus 20 is acceptable. Is there means we will be accepted is 2 score. If less than 20, we will be make us 1. More than 20 also make us 1. If it is maintained as plus or minus within limits of 20, we will give the 2. And
so you mean to say? Yes, please
activity,
continue.
we are maintaining the 4 extremities are apparent. According to sometimes may can consider as the finger movements are there for the spinal anesthesia patient. We can consider as the one also for when we're shifting. If supposed to be the score is less than 8, we will be continue the patient will be in the post anesthesia care unit and escalate to the anesthetist. If plus is equal to 8 or more than 8 means maintaining the patient, will escalate. In that time also we were escalating to the anesthetist. According to the fitness signature with the anesthetist, we will shift the patient or discharge the patient from the post anesthesia care unit.
Okay, very crisp update you have provided. Now, if I look at this checklist and if activity, you mean to say all parameters are assessed on the level of by marking 0, 1, 2 against each parameter, no? Now, if at all you look at this activity and 1, you have scored here, able to move 2 extremities, means what do you mean by this? Yes, I wish to understand from Lavanya, madam. Madam, you can just tell us a little bit on the same.
Yeah.
Yes.
Yeah, so in the first row, first column, we can see that in the activity she has marked 1. Means the patient has received spinal anesthesia and the patient is able to move both the upper limbs, hands, but the patient is unable to move the legs. So that's why the score is 1, that is able to move 2 extremities, not 4. But in the second, after 1 hour, that is at 7 p.m., we can see that she has marked it as 2. Means she is able to, patient is able to move all the 4 extremities. The spinal anesthesia effect has worn off. So that is why the score has become 2. So now the patient is good for shifting, stable for shifting. Yeah.
So this checklist directly states that this is the reading for the first 1 hour, and this is the reading for the second 1 hour. Total scoring: first 1 hour she scored 9, second hour she scored a 10, and she is ready to fit for the transfer out to the other unit or transfer out to the ICU. Yes. So the total score is 10. Patient scoring more or less 8 is a fit criteria for transfer out.
Yes, more than 8, we can shift the patient safely.
Yes. So, Tanu, I like to understand from you, like for example, if at all you scored, your patient is scoring low Aldrete score, as Lavanya madam has explained, and Pretty also has explained. For example, if patient remains stable, okay, you're observing. If above 2 hours or within 2 hours, if you see some likely event like patient is desaturating or score is not applicable, I mean low score, what do you do in that case?
We won't shift ma'am in ward or we won't discharge. We have to inform our anesthetic doctor and we will observe the patient more hours.
And do you communicate with the patient attendant
Yes,
also? Yes,
yes.
because they will be very anxiously waiting outside. So, yeah, the communication is very important to everybody. Yes. And yes, now, Pretty, so in this scoring system, we do have this very important column called vitals. Here we have pain scale. Here we have already spoken about the all rates, scoring. So, what is the frequency of vital sign monitoring here? Can you tell all our viewers how frequently you check, you monitor, you assess, and you document? Over
When
to
we
you.
are receive the patient from the OT, immediately for the 1 hour, every 15 minutes, we are monitoring the vitals according to pain score. After
Okay.
1 hour, we are assessing Aldrete score. Then the second hour, we are assessing the vitals every half an hourly. Then
Okay.
second hour completed, we are reassessing the Aldrete score. Then we will, if any variation is there, we will escalating to the anesthetist. According to that, we will be managing. If the pain score is more than 4, we will ask the help for the anesthetist to administer any other more painkillers according to post-op orders. With the escalation of anesthetist, we will be managing the vitals in this hour. These 2 hours, the patient was fit for shifting. With the fitness of anesthetist, we will shift the patient to post-anesthesia care unit.
Yes. So, ma'am, just Pretty mentioned all these parameter. Is it, right statement? Like, yes, frequency of vitals and pain scale measurement, etc.
Yes, it is correct. Means because we are measuring the pain scale using the visual analog scale.
Yes,
Means,
that's
yeah, visual analog scale, which has got a score of 1 to 10, and then accordingly 1 to 3 is mild pain, 4
yes.
to 7 is moderate, and then severe pain. So accordingly we will be assessing, and then if the patient is fine with mild pain, with which is controlled with oral or IV anesthetic and analgesics, we can shift the patient. That is not a problem. With moderate and severe, we will have to wait for some time, and then yeah, good to go.
And it is very important for every nurse's bedside. Please do not ignore the patient threshold for the pain, because if at all likely associated pains will definitely impact on the vital signs. Like patient may experience a tachycardia, and patient discomfort also will be likely causing the outcome. Yes. So here we are. Yes, Veronica, do you have any of your queries you wish to clear now? Yes, over to you, Veronica.
Ma'am, could you explain how often assess the pain scale, ma'am?
You
You
can
may have
assess the
taken.
pain scale.
Yes.
Yeah, you can assess the pain scale every hourly. Means if the patient is having severe pain, because we are
Yes.
going to give the patient some analgesics and it will take some time for the infusion to go and then take some time for the medicine to act. So hourly is enough if the patient is having moderate to severe pain.
And we have just come to the last slide, and here we wish to understand how should nurses, I mean to say, take the responsibility or own this checklist, because as likely associated patient safety is very important, and it is our topmost priority to safeguard the patient's outcome. Yes, over to you, ma'am. Or little challenges or corrections you would like to provide here, because everybody
Yeah.
is just having this virtual mode of learning. So it will be very appreciated.
So the slide is beautifully, it is showing off all the roles of the nurse in the PSU, like continuous monitoring, assessing the patient periodically regarding the pain, nausea, vomiting, hemodynamic status and everything. And then documentation is also equally important. And then escalate means whenever you feel there is any kind of a doubt in the patient's condition, you should immediately escalate it to your seniors or to the anesthesiologist who is always present in the OT. So, and then the discharge comes last. So continuous monitoring is very, very important. And then the calm demeanor of the sister is very, very important. That is also we are being nurses, we are used to that. So yeah, continuous monitoring and call for help is definitely important. And then
Yes,
the continuous care should be, you know,
yes.
handed over to the sisters, and then sisters in the ward should also follow the same thing. Yeah, continuous monitoring is very important to avoid any mishap.
Yeah. And especially monitoring remains very constant and consistent when patient is falling into high risk group as well, like elderly, pediatrics, and any patient who has come with the multiple comorbidities. So surgical intervention was very, little more complicated. Yes, I think yes. So this was a little short, crisp topic, and I thank everybody for your beautiful, for your participation and very valid time. I urge and request all the viewers to refer www.yashodahospital.com for more health updates, academics, and also watch patient testimonials, because if you do not witness evidence-based learning, then I think we fail to learn many things. Yes, and you see, refer our website for more learning. And I thank all the speakers, Pretty, Veronica, and Tanu, and my special thanks to Dr. Lavanya ji for within short time of information you have contributed your time. Yes, thank
It's
you.
a pleasure and honor. Thank you so much.
Thank you. Thank you, all the
Thank
speakers.
Thank
I
Thank
you.
you.
request all of you all, yes, to
Thank you
share
so
this,
much.
a link for more awareness. And any viewers, if at all you have any queries, you can post your comments in the Facebook comment box. We'll be just shortly answering to your reply. Yeah, thank you. And we end the session. Thank you.
thank you.
Thank you.